When we say diabetes, we usually mean diabetes mellitus, which means high blood glucose level. The most important characteristic of diabetes is high blood glucose level, which is usually more than 126 milligram per deciliter during fasting. It's fasting glucose level. Diabetes affects more than 10% of world population. It means it's extremely common disease, and if left untreated, diabetes have serious consequences, and complications include blindness, kidney problems, which is called diabetic nephropathy, and neuropathy. Also, diabetes increase risk of heart attack, stroke, and other serious diseases. Type 1 diabetes affects young population, less than 20 years. And type 2 diabetes affects usually older population, more than 45. That main difference is, first main difference is age. Second main difference is mechanism of action. What is mechanism of action type 1 diabetes? Our body is not producing enough insulin. That's a mechanism of action. Why don't produce enough insulin? Because our immune system mistakenly attack beta cells on pancreas and destroys pancreatic cells which are responsible producing insulin. So it's autoimmune disease. Type 1 diabetes is autoimmune disease because our own body attacks pancreas beta cells and destroys them. So we have no insulin, or we have not enough insulin. These both cases are type 1 diabetes. In case of type 2 diabetes, body have insulin, but our body does not respond properly on insulin. That's the difference, and it is called insulin resistance. If we want to imagine better, we can say analogy, and it will be, for example, in case of type 1 diabetes, we have no key. We want to enter into room and the door is closed and we have no key, so we can't enter into room. That's the analogy of what? This person is glucose. Glucose can't enter into cells without insulin. So we have no insulin, we can't enter into cell. So glucose has no insulin and can't enter into cell because key at this case is insulin, and no key, no insulin. So it's easy. We have no key. That's type 1 diabetes. And what is type 2 diabetes at this case? We have key, but this door is rusty and difficult to open, and we need to try several keys to open this door because door is rusty and old and does not respond properly on our key, and we need to change different types of keys. Now let's say, why is diabetes so important? Why should pay attention it to? What will happen if we left untreated? In case of type 1 diabetes, person's lifespan will be 30 to 40 years, not more. That's why it shortens lifespan, and this person will die if we left untreated. That's why intervention is important in type 1 diabetes. And what will happen in case of type 2 diabetes if we left untreated? It can reduce lifespan by 15 years, sometimes less, sometimes more, but around 15 years. That's why it's important. Also, third difference between type 1 and type 2 diabetes is obesity. Usually type 2 diabetes is associated with obesity or overweight, while type 1 diabetes is not correlated with obesity. Person can be slim, person can be almost any weight. But in case of type 2 diabetes, it's strongly correlated with obesity. If we say what is 3 most important things which can say about diabetes, we can say these 3. First, high blood glucose level, and this glucose level elevated constantly. Second, insulin insensitivity or lack of insulin. So we have insulin resistance or lack of insulin. First is type 2 diabetes, second is type 1 diabetes. And chronic organ damage. They can damage, elevated glucose level can damage different types of organs, because elevated glucose acts as a poison for our body. Now let's say about symptoms. What is the classical symptoms of diabetes? It's frequent urination, thirst, hunger. These 3 is dominant: frequent urination, hunger, and thirst. Fatigue and blurred vision also occurs. And if we ask, is this symptom same in case of type 1 and type 2 diabetes? Yes, they are same. But in case of type 1 diabetes, these symptoms occur abruptly and these symptoms develop fast. In case of type 2 diabetes, the symptom develops slowly and progressive. If we left untreated, what will happen? Weight loss, because our body can't utilize glucose anymore, and person weight loss. Slow wound healing happens because blood vessels are damaged, and if there is wound, it's difficult to heal because no sufficient blood supply, no sufficient nutrient and immune cell supply. That's why slow healing of wounds. And tingling in the feet and hands happens because nerves are damaged. It is called diabetic neuropathy. And diagnosis. What is diagnosis? Diagnosis is fasting blood sugar level more than 126 milligram deciliter. Oral glucose tolerance test more or equals 200 milligram deciliter. HbA1c level, which means glycolated hemoglobin, should be more or equal than 6.5%. It's also part of diagnosis of diabetes. And random blood sugar level more than or equal to 100. Of course, with symptoms. Now let's say treatment. In case of type 1 diabetes, treatment always insulin therapy. Insulin therapy with injection or artificial pancreas. In case of type 2 diabetes, lifestyle changing and oral medications, and sometimes insulin also is needed. Metformin is first line treatment usually. It can reduce blood glucose level by 15 to 30%. It's important. Sulfonylureas also GLP-1 receptor agonist or insulin if needed. They are second line treatment. Weight loss is important. Even 5 to 10% of weight loss can improve blood sugar level importantly. That's why it's so important. Of course, diet with whole grain and less sugars, less simple sugars, and more fibers also. So and physical activity. Physical activity should be 30 minutes per day at least. For example, 30 minutes walking per day at least. That's all I wanted to say. And I would add about gestational diabetes. It's type of diabetes, and not one or two. It's another type of diabetes which develops during pregnancy, and symptoms and this diabetes will resolve after childbirth. This gestational diabetes, but gestational diabetes can be sign of problem of insulin resistance, and eventually it can develop as a type 2 diabetes. That's why it still requires attention. Thank you very much. Thank you for your interest. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.